Introduction to Medical Terminology. Medical terminology is kind of like putting a puzzle together, and there's elements of the medical terminology that you need to understand, and that is the root of the word, which is the most basic part of the word, and then there's the prefix, and those are word parts that attaches to the beginning of the word, and the suffix, and those are word parts that attach to the end of the word. So word roots. Let's go over some of those in the body system, and we're going to be going over a lot of information. The more you become exposed to the medical terminology, the easier it'll become, and it's very dependent on the areas maybe you'll be working on. You'll see these more often. Let's talk about the body system. Cardio is heart. Gaster is stomach. Hepa is liver. Nephro is kidney. Osteo is bone. Myo, muscle. And cranio is skull. Now let's talk about the word roots that have to do with the blood system. Angio has to do with the blood and lymph vessels. Arterio, artery, sounds like the word root sounds like artery. Coag is coagulation or clotting. Erythro stands for red. And then we have the hemat, which is to do with blood. Let's talk about more word roots that have to do with the cardiovascular system. We talked about cardium and cardio, angio, arterio. Other word roots that are associated with the cardiovascular systems: athero, which is a fatty substance or plaque. Emboli, that stands for an embolus or a clot. Palpit and palpitations, that's a fluttering or throbbing. Tele stands for distance or far. And if you think about a telescope, we have patients who are on telemetry and their heart rhythm is being remotely analyzed off-site. Varico, if you think about varicose veins. And then we have vessels, which are the vasculo and vaso. And then veno stands for the vein. That's cardiovascular. The respiratory system. Okay, so words having to do with the respiratory system. So aspirate, that's inhaling. It also can mean removal. So a person, we'll talk later about a person, especially stroke patients, who might develop aspiration pneumonia. And that's because they've inhaled either saliva or food, and they've developed a pneumonia. They've inhaled that into their lung. Bronchus, that's your airway. Bronchiole, there's actually the bronchioles in your airway. So phaso is speech. So if a person is, say they are aphasic, and remember when you have a attached to a word, and we talked about this in vital signs, when you have a attached to the word, it means without. So a person who is aphasic is without speech, and you often see that stroke patients who are aphasic, and it means they've lost their ability to speak. Pneumo, lung, and then naso sounds like nose, so naso, and then rhino. also means nose. I always think of like a rhino with the big horn, kind of as a nose, and then a person who has a plastic surgery on their nose, it's a rhinoplasty. Nephro, urinary system. Nephro is kidney. Kind of talked about that. Reno, kidney. So your urine sounds like urine. That's what it is. And cysto means the bladder. So you'll hear a person who has cystitis. Okay, so what is cystitis? Itis is an inflammation, right? Infection, inflammation. And cysto is the bladder, so they have a bladder infection. So you can kind of see how it all pulls together. And depending on the area you work in, you will know different terms. Surgery has different terms you will become more familiar with than terms that are used on Gen Med or the neurology unit or the cardiovascular unit. And so even though you're not, you might get a patient, say you get a transfer from the cardiovascular unit, maybe not familiar with some of the terms, but we give you the tools kind of to break it down so you can kind of start to figure out what it's about. So colors, albine and Luke is white. A person who has and albinos who are white, they lack pigment in their skin and their eyes, they lack color. Leuco, white, and those are actually, we have white blood cells that are called leukocytes. Chloro, green, if you go back to your biology days, chlorophyll, it's a chlorosynthesis, green, having to do with those plants. And then Ciro, orange, yellow. I don't know if you've ever seen a person who has cirrhosis, which is an inflammation of the bladder, inflammation of the liver, and they turn an orange, they turn jaundice, which is the very last word there. Jaundice means yellow. Their skin turns yellow, the whites of their eyes turn yellow, and I mean it can be a remarkable yellow. It takes you back when you first see it, especially the whites of their eyes can be like a bright yellow. Cyan is blue, and if a person is cyanotic, that means they're not getting enough oxygen. So cyan, blue. And then we have a bunch of words for red and rosy, so you can read those there. So again, for you to sit down and memorize all of these would take a long time. Exposure, it's just going to be exposure. I would, when you have a patient and have a time to like read their diagnosis and their history, and you're going to see some of these words, and the more you're exposed to them, and then you can look them up, you can ask people, the more your vocabulary will increase. It's just kind of as easy as that. However, we're giving you the tools now to kind of break it down, so at least maybe get part of the word, if not the whole word, to know what the meaning is. So suffix is placed at the end of the words. So in medical terminology, the suffix usually has to do with a procedure, a disease, a condition, or a part of a speech. So we'll talk about, and we talked about previously, we talked about some of those. We'll kind of look at those again. In surgical procedures. So if you're going to a surgical floor, inpatient surgical, outpatient, OR, you're going to see these suffixes a lot. A centesis is to puncture. It's to tap, to draw fluid from. Ectomy is excision, removal. You cut it out. Think of a tonsillectomy. They're removing the tonsils. Plasty is a surgical repair or a correction. So I had referenced before a rhinoplasty. A nose job is called a rhinoplasty. It's a correction or a surgical repair. And sect is to cut. Stomy is forming a new opening, and we will talk about those when I talk about the GI and the gastrointestinal system, as well as the genitourinary system, in which people sometimes require ostomies, where the opening is brought out they form a new opening on the surface of the abdomen, and that is where then either urine comes out or stool comes out, depending on what kind of procedure they had. Let's see. Suffixes for diagnostic procedures. Manometer, we talked about the sphygmomanometer, instrument for measuring pressure. In the case we were talking about, blood pressure. The metry is process of measuring. So if you were, in the case if your patient's on telemetry, that means tele, remember that means far away. So we are, and then metry is measuring. So we are actually measuring their heart rhythm rate, their ECG tracing from far away when we add tele to that. Scuffy, like a bronchoscopy, is a process of examining, examination. So bronchoscopy is those bronchioles, and bronchioles, remember, is related to the lung. And gram is just a written record. It's a recording. More suffixes. Algia is pain. So you might take an analgesia, and that's to get rid of pain, gesia. Side, killing, it's an agent that kills. So think of bactericide. If something is bactericidal, it's killing the bacteria. Site is cell. Emia has to do with a blood condition. So here's where we talk about that A connected to a word. So anemia, A, it's connected to the word, so that means without. So the literal translation, without blood. Of course, you have some blood, but the anemia is that you're low in blood. Ism is a condition or a disease, hypothyroidism. So hypo, we know, is low, not enough of the thyroid hormone, and ism is the disease. And itis is that inflammation. Okay, so there's several examples we've talked about with itis, dermatitis, inflammation of the skin. Megalia means enlarged. Pathy is disease, and like apnea is breathing or breath. So when, again, the A is attached to the pnea, is apnea, and that's without breath. Porosis is porous. It's a decrease in density. So we talked about that already when we talked about osteoporosis. So osteo is bone, and porosis is porous. So it's a decrease in the density. So these people are more prone to having broken bones. Side, a killing agent. We've kind of talked about that already. And lysis is destruction. It's to break down. So sometimes there's a condition in which it's called hemolysis. And we know what heme is, right? Heme is blood. So it's the destruction or breakdown of blood. A lot of times, not a lot of times, but there are occasions when blood is drawn and the lab can't run it because it's hemolyzed. It's had hemolysis and the cells are broken down, so the sample isn't any good. The prefix begins at the beginning of the word and generally describes a location and intensity. They're found in general language. So we've been using these and probably not even making the connection. Autopilot, submarine. So now we talk about when we attach it to a medical word like ventilation, hyperventilation, fast. We talked about hyper is rapid, fast. But remember, not all medical terms do have prefixes. So prefixes, some of them you will see, and again, speaking to where a location is, ab is away from the midline. So if you draw a line down the middle of your body, ab would be moving away from that. Ad is towards the midline. And I always think of if you are going to ortho and your patient is on hip precautions and it says keep hips abducted, that means away from the midline, abducted. So, and they actually have wedge pillows that they'll put in between the legs to kind of keep them in that while the hip heals. I always think of, remember, abducted versus ducted, is when you're adding something to it. I'm moving closer, so I'm adding something to it. Acu is a needle, like acupuncture. Anti against. Hemi is half. So you'll see this like hemiparesis, half is paralyzed. Brady, we've talked about as being slow. Brady and tachy. Tachy's fast. And you'll need to know these, and I think that they are also on your, we'll see them again on the abbreviations list, is bi. Bi means two, or both, or double. Bicycle has 2 wheels. Tricycle, 3. Tricycle has 3 wheels, so tri is 3. And quad is 4. Maybe you've heard of a person who has quadriplegia, so that is a paralysis of all 4 extremities. Re is back, and super. Super is above or beyond, and supra is on the top side. And here's some more directional terms. I'm not going to go into these in great detail. If you're positioning a patient, you will know whether they're prone or supine. Supine's lying on their back. Prone is lying on their stomach. We don't see people lying. We don't position people lying on their stomach very much. However, I will say that with COVID, proning patients has become much more common on those who are really sick and struggling for breath, because they found that helps them breathe. So you'll hear of a patient being proned, and that's what they're talking about. And again, that had been very rare up until recently. The others are really terms that the nurses use a lot, in particularly in describing like where a wound is, it's on the posterior aspect of the superior iliac crest and that kind of stuff. And the more you see these, the more you'll know them. But really, the ones that you need to know are prone and supine. And of course, posterior is the back and anterior is the front. So putting it all together. Here we have cardiomyopathy. So cardio is heart, and we know myo is muscle, and cardiomyopathy is a disease process. So we have a heart muscle disease. Bradycardia, we've talked how Brady is slow and tachy is high. So that's the heart rate. And myo, okay, that's muscle. Right? Muscle. And cardia is heart. So myocardia is the heart muscle. You'll often hear that a person who has a heart attack has a myocardial infarction, and that's where that comes from, an MI for short, a myocardial infarction. Hypovolemia, hypo, low, so low blood volume, right? Emia is blood. And phleb, remember, that's a vein. Itis is inflammation, so it's inflammation of the vein. And hematology, ology is the study of, so this is the study of blood. Abbreviations and acronyms are commonly used to save time. They can be confusing. So if you are unsure of how to abbreviate or always spell the term out in its entirety. You do not use your own personal abbreviations, only those that are approved. And there's a list of approved abbreviations that can be found on the BJC intranet. Here's the common abbreviations. So A means before. Now, all this time I've been telling you, A means without, right? But that's only when it's connected to a word, when it's a part of a word. When it's separate, you will have, it will be, it stands for before, okay? So AC is before meals. It's not connected to a word. It's just an abbreviation. P is after, and PC is after meals. So we have O2, wheelchair, a chest x-ray, UA, urine output, a history. If a patient is up ad lib, that means at will, as desired. They need no assistance. They can go and ambulate, walk as they please. EKG is electrocardiogram. Then we have the greater than and less than signs. And a capital T or a T with a circle on it, that stands for telemetry. So their heart is being monitored, right? Tele, far. So the heart is being monitored far away. The patients who are on monitors or on telemetry, they are actually being watched down in a building off of Hanley and 40 is where the signal is being transmitted to. And we'll talk more about that when I talk about cardiology. AC, already, that's a repeat. AC is before meals. So no QD, BD, TID, and QID. Q day is once a day. And BID, just remember, bicycle, 2 wheels, BID. Tricycle, 3 wheels, TID. And then QID is 4 times. HS stands for hour of sleep, but that means at night. So it might say, blood sugar before meals and at HS, which means out at night. Usually that at HS is 9 p.m. BM is bowel movement. More abbreviations. BP stands for blood pressure. VS, vital signs. If you see TPR, that stands for temperature, pulse, and respirations. NPO stands for nothing by mouth, so those patients cannot have anything by mouth. Usually you'll see this quite frequently on surgical floors or when people are getting ready to go for procedures and they cannot have anything until after their procedure is done, and so they are NPO. LOC stands for level of consciousness. C/O stands for complaints of. So often you will see in a patient's chart this abbreviation followed by complaints of chest pain, shortness of breath, which is our next abbreviation, SOB, for shortness of breath. But CO stands for complaints of. PT stands for patient. C is with, S is without. And you'll see those quite frequently. C stands for with, S is without. BR stands for bathroom. BRP stands for bathroom privileges. BSC, bedside commode. TX is treatment. NNV is nausea and vomiting. And then TCDB stands for turn, cough, deep breathe. So patients, particularly those patients who have surgery and are maybe reluctant to move, we like to get them turned and taking some deep breaths and coughing so they don't develop any type of pneumonia. So that's TCDB, turn, cough, deep breathe. Usually I'll say turn, cough, deep breathe, Q, which stands for every, Q, 2 hours, 4 hours, whatever the order reads. INO stands for intake and output, and WT stands for weight. So I know I gave you a lot of information, and like I said, the more you're exposed, the easier it'll become. And remember that the abbreviations, the approved abbreviations, if you don't know what something is, it can be found on the BJC intranet. And that concludes medical terminology and abbreviations.